Hey everyone, Ashok here from DHP with another featured guest. Got Dr. Aron Choi sitting with me today talking about the ketogenic diet and its use in clinical practice. Dr. Aron Choi graduated from Bastyr University in 2014 with a doctorate in naturopathic medicine. He's currently practicing in the U District in Seattle with a clinical focus on chronic disease, whether it's digestive or metabolic or otherwise. He enjoys using diet and lifestyle modifications like the ketogenic diet in clinical practice, along with manual therapies and a lot of physical medicine, especially visceral manipulation, which he's quite good at. He also enjoys practicing what he preaches. He's an avid long distance runner, and he really focuses on diet and lifestyle and exercise in his own life as well. So, Dr. Aron, welcome. Thank you for sitting with us.
Thanks for having me.
Awesome. So, first off, just basics. What's the ketogenic diet?
The ketogenic diet. We hear about it so much.
Yeah.
And simply put, it's a way of eating that promotes your body's ability to use fat as fuel. So if we think of our bodies, we have two main sources of energy, sugar or fat, and we're eating in a way to be able to access that fat as energy. And there are a lot of health benefits to that, which we can go into in a little bit.
Cool. So, well, actually, let's just name some of the simple ones. Like, what are some of the simple benefits that people start to notice right away?
Yeah. So simply, a lot of people use the ketogenic diet for weight loss.
Okay.
It's also beneficial for children with epilepsy. It's one therapy epileptic children might be put on if medications aren't working as well for them. As an endurance athlete and as someone who wants to improve my cognitive function and my energy levels throughout the day, I'll use it to make sure that I don't need to fuel as often. I don't need to have as many goos when I run. And just the amount of clarity I have on the ketogenic diet, it just seems to be a great way to eat to promote overall health.
Very interesting. That's kind of what I've heard. It's starting to get used for a lot of different things now, but it's been around for a little while, right? Like, it was discovered a long time ago.
Long time ago. I was just actually reading up on this. So the research first showed up in the 1920s, 1930s, but there's actually references back to the Greeks, way back. The Hippocratic kind of method of things, of using fasting and eating fats, a diet higher in fats and lower in carbohydrates kind of mimics fasting. In the 1920s, there was Aron Warburg, who
Right.
was studying cancer not just as a genetic disease, but as a metabolic disease, and he wanted to find a cure for cancer, and he won a Nobel Prize, for his work. So he was friends with Einstein. So he kind of traveled in a pretty well-known group of scientists. So the research has been around the ketogenic diet for a lot of different things. So cancer, epilepsy, bodybuilders will start using it maybe a couple decades ago.
Right.
So there's also research in performance, endurance sport.
Interesting. Cool. So what got you interested in using it? Like, what made it a part of your clinical practice as a tool for treatment?
Probably my interest in nutrition and food started, years ago. My mom's a pharmacist, so a retail pharmacist.
Oh.
But it was her influence. She always said prevention is the best medicine, nutrition is important. So hearing that from my mom, whose job it is to help people take medication safely and responsibly, her telling me that nutrition has a big influence on health, kind of planted that seed. And it was only probably within the last year I was speaking at a conference and met a friend who was a nutritionist in the UK, Alessandro Ferretti. I met him through Dr. Ben Lynch at the Seeking Health Educational Institute, and he just showed amazing data, amazing information about how the ketogenic diet could be used to treat people's illnesses, like very severe issues with chronic fatigue or genetic issues, food as that foundation for health, that determinant of health. That is really the foundation for how we should approach people who are sick.
Yeah.
Everything else is, if we have a three-legged table, it's not really going to do so well standing up, right? We need that foundation there before we place other therapies on it. So that was a wake-up call for me. It's like, okay, I want to start experimenting with this on my own and start helping people kind of build a stronger foundation to be healthy, so that we can help them feel better.
Totally fascinating. So clearly, it's kind of changed a little bit since its inception. Back in the 1920s, 30s, or when it was first written about by Dr. Warburg. With his theory on cancer metabolism and all that. But what does it look like now? How has it changed? What does it look like in practice now?
Yeah, so in practice, maybe we didn't mention this up front, but it's a lower carbohydrate, higher fat.
Okay.
Eating. If we think of the standard American diet, maybe 50-60% of our calories come from carbohydrates. Pasta, bread, cereals. A lot of those staples of a standard American diet. And so in practice, that might be lowering that percentage of those types of foods to maybe 10-15% of total caloric intake. And of course, when you kind of reduce one food group, you have to kind of replace it with another.
Right.
And healthy fats are the way I like to approach the ketogenic diet. So meaning 70%, 75% fats, and then the rest is clean proteins.
Wow, interesting. So as a not so much just like a diet, this is like a lifestyle modification. This is like a treatment, as a clinical tool. So I assume that there are more assessments and or tests and specifications to the treatment than just putting somebody on a regular diet.
Yeah, absolutely. Yeah, with the ketogenic diet, there's no one size fits all.
Okay.
So there are things you can do on your own, but if someone is using it to treat an illness, maybe they have cancer, maybe they have diabetes or high cholesterol, cardiovascular disease. You want to approach that with caution. There are genetic issues, inherited kind of diseases that might preclude someone from doing the ketogenic diet. Like if they can't metabolize fat well, we're not going to put them on a high fat diet.
Okay.
So, right, and it's important to use it cautiously, to use it wisely, and there are assessments, tests to determine if it's, and also we have to make sure that someone's history doesn't prevent them from maybe benefiting from this type of diet.
Gotcha.
Yeah.
Interesting. So has it, we're saying, okay, almost a century that it's been used in some way or other. What have you seen as far as the trend in popularity or acceptance? Is it gaining some traction in the medical world, in the nutrition world, or not so much?
It's funny. I remember my first year in medical school. It was probably 2010. So, in first year medical school, you're learning biochemistry, physiology.
Yeah.
You think you know a lot. And a friend comes along, from a college friend. He's like, "Hey, have you heard of the ketogenic diet?" And the only context I heard of ketones was ketoacidosis, which is a severe life-threatening condition that diabetics can experience.
Yeah.
And it sounded dangerous, this ketogenic diet. Why would anyone be on this ketogenic diet? It might kill them. But within the last couple of years, like I mentioned, I'm seeing, okay, that is different. Ketoacidosis is someone whose metabolism is uncontrolled. They're severely sick. Right. It's probably not right for them, and that's when we need to monitor it.
Okay.
But now we're understanding the wide applications in health. It's becoming a lot more popular, and it's actually not as extreme as it sounds.
Okay.
It's a little different.
Yeah.
But now it's just kind of a way of eating, a way of living that healthy people can use, people who are not feeling so well can use.
Yeah.
And I think it's a lot of the stigma around it is lifting.
Okay. And so with that a little bit more acceptance or use, has the research kind of followed? Like, has the research started to show a little bit more about its safety, especially long term, or its effectiveness? You starting to see that?
Yeah, we're starting to see that more. We're seeing the ketogenic diet being studied in different areas. Okay, EPs are with epilepsy. Then a little bit more work around cancer. Then a little bit more work around high performance athletics, and neurodegenerative diseases like Alzheimer's, Parkinson's. There's more research starting to emerge, and it's not complete. I don't think we have definitive answers, but there's a lot of promise there around demonstrating safety as something to explore as a therapy. It's not the answer,
right?
But it's something I think we should consider strongly.
Okay.
For a lot of people.
Interesting. So on that note, I guess when you start to consider it, what role does something like the ketogenic diet play in like the naturopathic principles? What principles most strongly come up or guide your practice when you're using the ketogenic diet?
Yeah, so for people who aren't familiar with the naturopathic principles, I mean, it's really about understanding the whole person, teaching people how to be healthy, not just giving them something to take and expecting them to follow your orders. And I think that's where I enjoy working with helping people eat healthier, maybe using the ketogenic diet. And the principle that I think kind of the diet therapies fall under is doctor as teacher. How can we empower people to make better decisions around what they eat to affect how they feel? So I think it's easy to overlook the fact that, what we're eating is actually affecting our performance. It affects our mood. When you come home and you're hangry, you've been eating sugar all day. How do you experience that with your significant other? Are you snappier? Are you crashing throughout the day? Are you reaching for that donut constantly and coffee? So teaching people to make some decisions around how they eat can really have a lot of ripple effects, positive or negative, depending on how you eat.
Yeah.
So how can we teach people how to do that? I'm not there to cut their food and put it in their mouth for them.
Right.
They spend an hour with me every few weeks or a month or even longer. So what are those skills we're going to give people that they can go and implement on their own?
Cool. So with that, with using a diet in clinical practice like that, like it's a lifestyle modification, and so I would assume that it comes in pretty low on the therapeutic order then.
Yeah, and so if we think of the therapeutic order, different levels of intervention. Starting with establishing a basis for health, removing obstacles to cure, then maybe pharmaceuticals and surgery as higher interventions. We might call it a lower level intervention. So it's a low force intervention, but it doesn't really say anything about its effectiveness. I think a diet therapy is a low force intervention with very high effectiveness.
Interesting.
So that's the way I think about it. So, and I'd rather use something low force with high effectiveness than have to get to a point where I have to use a medication or I have to resort to surgery.
Right. Okay. So going into a little bit more of your actual practice with it, what are the most common conditions that you see that you think, okay, hey, this is somewhere where I can use the ketogenic diet, or when does it come up most often for you?
Yeah, I mean, day to day, I help a lot of people with that metabolic syndrome. They might be a little overweight, their cholesterol's a little high triglycerides, high blood pressure, a lot of these common precursors to some of the top causes of death in the United States. Number 1 is cardiovascular disease. Number 3 is strokes, cancer's up there, diabetes. So this metabolic syndrome, these dysfunctions in metabolism, using glucose and being able to use fat as fuel flexibly, seems to be at the root of a lot of severe illnesses that people are going to eventually suffer from. So in practice, using the ketogenic diet, we can help correct that high cholesterol, that hypertension, the high blood sugar, the insulin insensitivity.
Right.
With a very low force high effectiveness.
Cool.
intervention.
So this is where it gets interesting for me, and I get really excited to compare the two when you look at, for example, like you said, metabolic syndrome. Somebody walks into a doctor's office and they get the standard conventional treatment for that. How does that compare to the ketogenic diet or naturopathic treatments along with the ketogenic diet, as far as force of intervention or where it falls on the therapeutic order? Are those even comparable?
I think they are, we'll compare them. So if someone comes in with metabolic syndrome, they're gaining a little bit of weight, their waist size is increasing, their cholesterol is high, their triglycerides in their blood are high, their blood pressure is high. What you'll often see is if they're high enough, you'll start managing them with medication. So one medication for blood pressure, one medication, statins for cholesterol, one medication for high blood sugar, metformin, for example. And what we're doing is just addressing symptom by symptom without actually getting to the underlying cause.
Right.
And and in some cases, you have metabolic syndrome, you're not sick yet, so maybe we'll wait and see until you're sick. I know what are you waiting for?
Right.
Or the patient's left with advice like, focus on your lifestyle and diet and exercise a bit more. Okay,
right.
What does that mean?
Yeah.
What does that mean? So from a naturopathic standpoint, and from the way I like to look at it, is how do we reestablish a basis for health? How do we prevent that metabolic disease from progressing to a point where they might need medication? Or if they're on medication, how can we see if we can kind of wean them off some of those medications so that they're not on them for life? Which is also what I see. People who are on medications just kind of expecting to be on them for life, and I wouldn't want my patients to think they'd have to take something, take a medication, which they're not without adverse effects.
Right.
They're not harmless.
Right.
So why would we try to keep someone on them forever if we know that they might suffer some other consequences down the line?
Interesting. So, in fact, we can actually not only act at a possibly lower therapeutic order or a lower force, but we can actually lower the therapeutic order that is being used to treat them in general. Like you said, taking them off medications or weaning them off. That's pretty effective. That's pretty good.
Mm-hmm.
Cool. No, that's and that, like I said, that's what's most exciting for me to see and compare and see that there's different times when we can use different therapeutics and get wonderful results without using such a high force.
Yeah, and maybe I didn't share this story with you, but one of my patients who kind of had this metabolic syndrome picture, mid-40s, busy guy, works in finance, travels a lot, 10 days a week on the road, wife, 2 active children, pretty, they're living a good life, but also very busy life.
Totally.
And he came in with these medications, and we discussed the ketogenic diet. He was fully committed. He didn't want to be on medications forever. He used to be a triathlete, swimmer, and maybe he let himself go a little bit. And we made some changes. One of those changes was making some changes to his breakfast. He ate cereal every morning since he was in college, and we made some changes in terms of what he was eating. So he started eating lower carbohydrate, higher fat meals for breakfast. And within a couple months, he lost 9 pounds over the holidays. He had not been sleeping well for a long time. He started sleeping better. He had some other symptoms that, maybe that were just kind of bugging him, and there was no clear issue, but those kind of went away just by making simple but effective lifestyle diet changes.
Fascinating.
Yeah.
That's very interesting. And like you said, it's simple. So that kind of leads into what I wanted to talk about next, is that what's the purpose of going and seeing a naturopathic doctor or anybody who's an expert on the ketogenic diet instead of just going on Dr. Google and just starting the ketogenic diet on your own? Are there risks involved in doing that?
Yeah, when I think of medicine or therapies to address a specific problem, there's always some amount of risk. And if someone's considering a ketogenic diet to address a health issue, diabetes, high cholesterol, maybe they had some cardiovascular disease, you want to work with a doctor to make sure it's right for you. We want to make sure we don't compromise maybe your health if it's already a little bit compromised. And we want to make sure, okay, your cholesterol isn't skyrocketing because you have some hereditary issue that kind of precludes you from eating a high-fat diet.
Interesting.
Or we don't want your diabetes to be uncontrolled, while you're making some of these changes. So, maybe your insulin level, if someone's insulin dependent, they might need to reduce their insulin dose because, they're becoming more insulin sensitive, or their blood sugar isn't as high as it used to be.
Right.
Or, with blood pressure, if someone's blood pressure is dropping and they keep the same dose of blood pressure lowering medications, their blood pressure might drop too low. And then you have issues. So when you work with someone who's trained to think about these things, to monitor these things, then you can be kind of rest assured that you're approaching it as safely and effectively as possible.
Cool. Okay. That's great. So here's where I want to give you your chance to kind of jump on a soapbox a bit and kind of give your top health tips. Basically what I like to call the 3 top threes. So the first 3 is basically 3 things that you want every patient to avoid, or you would tell every person to just avoid to maximize their health.
Yeah, my top 3 to avoid, I'd say the first is stress. And, largely I think it's psychological, emotional stress. You're working 24/7, thinking about work all the time, feeling anxious, reading the news, which is often negative news. And that can really affect not just your emotional health, but your psychological, physical health as well. Yeah. Stress also includes physical stressors. Are you sitting too much? That's a physical stress. Are you eating poor quality food? That's a physical stress. So removing the biggest sources of stress in your life to help your body actually do what it was designed to do and be healthy and to feel healthy.
Okay.
Along the lines of a ketogenic diet, if someone's not ready to jump in all the way, one of the simple things, maybe not easy, is avoiding processed sugar. So processed sugar in tiny amounts is fine, but I think it's just we're eating so much sugar without even knowing it. That protein bar, I used to eat a lot of Cliff bars. People are like, yeah, these are energy health bars. And you look at the back and it's like 25 grams of protein, which is maybe like half a can of soda worth of sugar. Yeah. A can of, just for reference, a can of soda is like 9 teaspoons of sugar. Wow. Which is a lot.
Yeah.
And you might not even realize you're eating that much. And we know that having that much sugar affects, your weight, it affects your mood, it's inflammatory. So avoiding sugar in any appreciable amount will make a big difference.
Okay.
The third thing to avoid is highly processed oils. So people are thinking, the ketogenic diet's a license to eat fried foods, or all the bacon and all of those goodies that I really love, donuts, whatever. However, highly processed oils, canola oil, vegetable oil, corn oil, soy oil, which are found in a lot of processed foods these days, it's like putting damaged fats into your body and just asking for inflammation. If we think of our cells, the cell membranes are made from fatty acids. Do you want damaged building blocks making every cell in your body? And probably not. So I say avoid processed oils, and start thinking about, how can I eat higher quality fats? From avocados, coconut oil, virgin olive oil.
Great.
Things that aren't fried to death.
Right. Okay. Cool. 3 things to avoid. That's great. So the next would be 3 things that everybody should do on a daily basis. 3 daily practices for optimal balance in daily health.
Yeah, I like how you say daily habits, because habits are kind of the foundation for for how you feel. So the first habit, I think, is movement. Starting your day with 15 minutes of walking. Maybe it's going to the gym. Just get the blood flowing, get the the heart pumping a little bit. And we know that when you move, it kind of increases your brain function and insulin sensitivity. So it's also relaxing. A little stress reliever. So when you start the day taking care of yourself, I think the rest of the day starts feeling like just things kind of fall into place a little more easily. So the first tip is start exercising in the morning. Number 2, getting enough sleep. That's an underrated kind of health enhancer, performance enhancer.
Right.
We think that, we have to work harder. But when does your body actually recover? When does your body actually repair and build? It's when you sleep.
Totally.
And then we know sleep is really important for, if we think of people who work the night shift, they have higher risk for heart disease. They have higher risk for depression. They have higher risk for just all-cause mortality. So sleeping, it's a good habit. 7-8 hours, and everyone's a little different. Let's start playing around with that.
Okay.
The third thing to incorporate is community. Surround yourself with people you would like to be like and that you enjoy being around. So if you're trying to eat healthier, you're not going to go hang out with people who are, I can't even think of a good example, but not to demonize anyone, right?
Right.
If you want to eat, hang out with people who enjoy eating fresh foods, where it's normal to eat healthy. And then you're more likely to eat healthy in return.
Right.
Or if you want to exercise more, hang out with people who exercise.
Yeah.
I wanted to be a runner, or I wanted to run more, and I started running with a group who it was normal to run every day at 5:30, 6 a.m.
Yeah.
And it just becomes kind of normal because everyone's doing it.
Yeah. Okay, great. So 3 things to do every day. And then the last thing is going to be 3 things for just optimal health in general. 3 tips for overall good health.
Yeah, so if we think of the habits, I think the first thing is establish some type of routine that is healthy. And not doing it all at once. So if you feel like you want to make some changes with your diet and you want to be a little healthier, you want to exercise a little bit more, you're setting yourself up for failure if you try to do all of them at once. So pick one thing. Maybe it's your sleep. Okay, I'm going to start turning down the lights an hour before I go to sleep. I'm going to turn off my phone. If I'm staring at Netflix for an hour and wondering, watching The Walking Dead, wondering why I'm having anxiety at night, it's like, okay, maybe there's some things you can do to help yourself sleep better.
Yeah.
So it's establishing one small habit that you can start making that first step towards that health goal that you're trying to create for yourself.
Right.
So one small step.
Okay.
Is what I would say for that. Number 2, optimal health. Just if we're thinking of stress, start by identifying what is my biggest source of stress. It's different for everyone. Maybe it's a relationship that's been just kind of hanging over your head. Right. How can you start creating something a little bit more positive around that? If it's eating too many bags of chips, I use that example because that was mine.
Oh yeah.
Yeah. Starting in medical school, I found myself eating entire bags of kettle chips at night because I was essentially kind of dealing with stress.
Yeah.
And that carried on for a long time.
Wow.
So, so that was my source of stress and how I was dealing with it. And once I started removing that from my life, I started feeling a lot better. Odd. Right?
Go figure.
Yeah. Kind of the third thing for optimal health. I think this is kind of underrated for stress is hydrotherapy.
Huh.
Whether it's taking a hot Epsom salt bath.
Yeah.
Finishing with a cool shower. It gets the circulation going. It's calming. It's relaxing.
Right.
I think people need a few more baths. I'm not afraid to add a little lavender oil, light some candles. Okay, maybe no candles, but however, creating a mood to actually where you can relax, like where you can have a little downtime, a little personal time. Great. So those are kind of 3 practical things I think people can start doing for optimal health.
That's awesome. You know, I love doing these little segments of getting everybody's tips, because I feel like I have this big journal of all the good things I can do for my own health now every time I talk to another doctor sitting here. So that's great. Thanks. So Dr. Aron, I know that people are going to watch this. I know people already talk about the ketogenic diet, and they're going to be interested. They're going to want to know more. And they're going to want to know more about you, your practice, or follow that a little bit. Where can people go? What can they do to learn more about it?
Yeah, I actually created a 7-day keto breakfast challenge for this very reason, right? What's that first step someone can take? And it's like, okay, just start with breakfast. So I created a small challenge. It's totally free. There are recipes that people can access and videos of myself and my partner, Chef Heidi, who came up with the recipes, talking about the ketogenic diet. So you can go to my website, aronchoi.com/keto-challenge. That's KETO-challenge. Or aronchoi.com just to see what I'm up to. I write blog posts, and I do that regularly. So if people are interested, that's where they can find me.
Wonderful. Again, thank you, Dr. Aron, for joining us. I think this was super cool, super useful. So
I enjoyed it.
It was
Thanks
awesome.
for having me.
Great.